If someone in your family tests positive coronavirus, there's a good chance it will spread to other family members. That's according to a new report from the CDC. The Centers for Disease Control also says if someone in your home shows symptoms, they should isolate immediately. Joining us to talk about recovering from COVID is family physician Dr. Nicole Swiner. Dr. Swiner, good to see you.
Hi, how are you doing?
Doing great. Hope you are as well. Recovering from COVID-19 can take a long time, even in young adults with no chronic conditions, right?
Yes, so the more that we learn about this, the more that we're in this pandemic, we're now learning more about this post-COVID syndrome that exists for weeks or maybe months after someone is infected.
Yeah, we're talking 1 in 5 previously healthy young adults not back to usual health 2 to 3 weeks after testing positive. So what should people do to stay well and protect others?
Well, the most important thing, of course, is to not catch COVID as much as you realistically can by continuing to wear your masks and socially distance. The holidays are coming up, so it's going to be a little bit more difficult to do that. But preventing yourself from getting COVID is number one. And then number two, there are, some supplements and vitamins that we're all talking about nowadays, like vitamin D, elderberry, and vitamin C that are important for this cold and flu season as well.
And when we say wear face coverings consistently and correctly, what do we mean?
Yes, please, please, please pull the mask over your nose. I've seen people repeatedly out and about, with the mask that is below their nose. Please pull it all the way up. Some people say even below the lower eyelid, right? Touching that. So you have to wear it correctly. You have to make sure it covers your chin completely because you don't want air to both enter or exit. Wearing it inconsistently is not helpful.
And another thing, when you are wearing the mask, you can talk through it. You don't need to take off the mask to talk to someone. Your voice will travel through the mask. Once a patient is out of quarantine or returns from home, what are some of the lingering effects that they might experience? This can go on for more than just a few days.
Correct. For my patients in my population that have both been hospitalized and been treated at home, the most common complaint I've heard of is fatigue. The second one is probably cough, and the third one is neurologic, whether it be trouble with concentrating or mental health changes like depressed mood and all of that. But the number one thing that we're going to have to deal with from here on out is going to be this chronic fatigue that we're noticing.
All right, Dr. Swiner, always good to talk with you. Thanks for your insight. We appreciate it.